Hi, my name is Kelly Presnell. I'm a nurse practitioner at Tanner Clinic in the Endocrinology Department. I've been here for about 5 years, but I'm a local in Utah. I grew up in Clinton. I went to Weber State University for my nursing degree and then finished it in Missouri. Here at the Endocrinology Department, we treat a lot of different medical issues and concerns. I mostly see diabetes and thyroid disease, but we also treat osteoporosis, pituitary gland issues, parathyroid gland issues. But one of the most common is hypothyroidism or low thyroid function. It's a very common disease. About 5% of our population in the United States have this condition, and many of them don't even know it. Symptoms to watch for would be fatigue, dry skin, constipation, maybe hair loss too. If you have any of those symptoms, it's a simple test. You can see your primary care doctor and have your thyroid levels checked. You don't necessarily need to see an endocrinology department to have this diagnosed or initially treated. It's also related to your autoimmune system, which is a genetic condition. Hypothyroidism often runs in families. So if you have a family member who has hypothyroidism, it's a good idea to be checked if you have any symptoms at all. Also, another symptom is an enlarged thyroid right here at the base of the neck. If you have a large thyroid, have your thyroid levels checked. Kids who have hypothyroidism, you'll often see a large lump at the bottom of the neck. So if you have hypothyroidism yourself and if any of your children have that, it's worth having that checked as well. There's many different medications we can use to treat hypothyroidism. The best, in my opinion, are levothyroxine and liothyronine. They are pills you take in the morning once a day, and they correct that thyroid dysfunction. They're very simple to take, they're inexpensive. Many times, primary care providers will treat you with levothyroxine, and then if you have continued fatigue, I believe that starting on an additional pill of liothyronine is beneficial. If you have hypothyroidism, having your thyroid levels checked at least once a year is important. I recommend every 3 to 6 months, especially if you're still having some fatigue. If you have diabetes, it's important to watch for the complications of this. I recommend that you have an eye exam with an optometrist or ophthalmologist once a year. We need to check your kidney function at least every 6 months. We'll do that during part of your visit. Also, daily foot exams are important, watching for any cuts, wounds, blisters, sores, etc. If it's not getting better within a week, it still could be infected if you have diabetes, and you should go see a primary care provider to have it evaluated or a podiatrist. Also notify your endocrinologist if this is occurring. If you have diabetes, it's important to watch for symptoms of hyperglycemia. Most common symptoms are frequent urination, dry skin, and increased thirst. If you have these, it's important to check your blood sugar. If it's over 200 persistently, please let your endocrinologist know. When treating diabetes, a lot of the medications can cause hypoglycemia. Symptoms of this are usually sweatiness and shakiness. Some people are more tired or more hungry. Family members may tell you that you're more irritable. If you have any of those symptoms and you're on diabetes medications, you should check your blood sugar. If it's under 70, then treat this with a fruit snack pouch or half a cup of fruit juice, or you could just eat a piece of fruit. Would correct that as well. A common tool that we use to treat type 2 and type 1 diabetes are insulin pumps. These aren't appropriate for all patients. They're appropriate for those who have multiple daily injections of insulin, such as a basal insulin with also injections before meals. The idea of an insulin pump is that you'll have a device like this that has insulin that you put in every 3 days, and then a tube connected to it, which will then connect to your abdomen or your arm, and that will give you small amounts of insulin all day long. And also at meal times, you can easily go onto your pump and type in how much sugar you're going to be eating or consuming, and then the pump will automatically give you the amount of insulin that you need through the tube. No more injections are required at that point. These are very useful devices. No longer do you need to give injections, but also if you have a continuous glucose monitor, which also goes on your skin, that monitors your sugars very closely. It checks your sugars every 5 minutes or so. That can connect with your insulin pump, and together they can self-adjust your insulin and be kind of a partner in your treatment of diabetes. When you're not able to look at your blood sugar, your pump will be automatically increasing or decreasing your insulin to provide more safety for you. Another option is a tubeless insulin pump. This is called the Omnipod, and it's where you have this small pod full of insulin connected to your abdomen or your arm or your leg. You fill that with insulin every 3 days, put on a new pod. It connects to a separate device, and through this device you can enter how much sugar you're eating. You can give yourself a correction of insulin to bring your sugar down, and without tubes at all, it'll read and give you that insulin. Now, coming soon will be available a new system with this Omnipod where you'll have the continuous glucose monitor connecting to that pod and automatically adjusting your insulin for you. That will be available in late 2022, which would be a similar system to the one connected through tubing.